Hello again, Dr. Davin Turner here. I'm the president of the hospital in St. Joseph and your chief medical officer of the system. I wanted to give you an update on where we stand with COVID patients as of today, November 9th. We have eclipsed a new high at reaching over 80 patients in the system. And again, when I say system, that would include St. Joseph, the LTAC at St. Joseph, Albany, and Maryville. Today, we have approximately 81 patients in our system. 74 of those patients are in St. Joseph. 6 of those patients are in our ICU and 3 are vented. 48 are on 5 East and the rest are on 4 East except for 1 that is in OB. Maryville has 7 patients. As you have seen, we see the number of positive cases occurring in St. Joseph increase on the city count, and we also have seen the number of positives within our system increasing. I want to talk to you now about where the patients are located. 4 East is now gone to negative pressure, and that was our design to overflow area, and this has occurred. So we have 5 East full, and we have moved down to 4 East. The other thing now I want to move forward with is staffing. I want you to all understand we definitely do recognize how hard our staff is working. Every one of our caregivers is working extra shifts. They're helping out their friends, and they certainly are watching over those in the community as we move forward in taking care of the patients that we need to take care of. It's very true. Emotionally, this is difficult. It is stressful for all. It is stressful for us, and it is stressful for the community. And I want you to know that certainly we are listening to you. We are having town hall meetings to inquire what can we possibly do during these troubled times to make things better for all. But what I also want to say is we're not panicking. We've been planning for this since March. We've known the numbers would eventually increase, and certainly they have. But we've been able to stick together, we've been able to work together, and we've been able to manage. We are not overwhelmed, but we continue to be vigilant. We are working with agency providers so that we can have increased staffing. Understand that there are nursing shortages across the country, and that we are working through those challenges to make sure that we have adequate staff here to care for the patients. We understand that this is tight, and we certainly appreciate everything that everyone is doing. And again, I can't say enough, the nurses, the techs, everyone, housekeeping, dietary, pharmacy, spiritual health, supply chain, grounds, everyone is working so hard to make sure that we are here to provide care for the patients and the families that we care for. I think you will notice around the organization that we will be turning the exterior lights blue. And certainly, if folks want to come and join in, that is in support of our caregivers. A question continues to rise, what are we going to do about surgeries? Well, we have to continue to do surgeries. One of the worst things I believe that was ever stated early on is the word elective. Surgeries, I'm not saying there aren't some surgeries that are completely elective, but they even deem cardiac surgery as elective. And what does that mean? That means you came in, you need to have heart surgery, but we let you get stronger so that we can take you to surgery. In an emergency situation, we go straight away. But if we are allowed to give that patient the time to get a little stronger, it is still an urgent surgery, and these cannot be delayed indefinitely. We evaluate this every day through shared decision making with our surgery oversight teams, which include not only the surgeons, the staff, anesthesia, but many others to talk about what we can and can't do inside the organization. This is our highest priority as we move forward, is the caring for the patients we have, because besides those surgeries, we still have 200 patients in this hospital receiving care, and they are receiving care for multiple issues. We have been ready for this. We have plenty of protective equipment. We have plenty of other supplies. What are we looking for? We are looking to increase staffing, and we need to support our staff because they've been supporting us and the community. What would I ask you to do? When you're out, when you're here, wear your mask. And also in the community, you need to recognize if you see someone not, it is okay to gently nudge them. They need to wear their mask. They need to wash their hands. And if you'll recognize this bump, it's only a few weeks after Halloween. We have upcoming Thanksgiving, Christmas, and New Year's, and we are still right here in the thick of COVID. Certainly be conscientious about your social gatherings and and where you surround yourself. And can you socially distance? Can you wear your mask? We just ask that you use good judgment, good common sense, and certainly think through this as you move forward. Pan. We have been working with this now for multiple months. We have used exceptional input from all of our caregivers, and we really look to you and to the community to take care of everyone. Understand the community that we are serving are multiple counties, and that's where we see these patients come from. The majority of patients are coming from here in Buchanan County, also Andrew, Doniphan, Nottoway, Gentry. So we are here to take care of those that we take care of. Take care of yourself, take care of each other, and understand we are working diligently to also take care of you. Thank you.